Well, hey, everybody, welcome to the Seeing Ability podcast, where we're having a conversation about the world of individuals with disabilities. And that means we're going to be talking to a wide variety of people. Sometimes it's an adult who grew up as that child with a disability. Sometimes it's parents that are raising kids with differences, and a lot of different people that support this community. Maybe it's folks in education, people in healthcare, individuals working in a lot of different nonprofits. And we're really excited. First of all, I know you've got a lot of choices when it comes to your super valuable time. Thanks for listening in today to the podcast. I'm joined today by Dr. Julie Bindeman. Julie, welcome to the podcast.
Thanks so much for having me, Jim.
Yeah, it's great to have you. I think people are going to love hearing from you today. But as you know, we like to just connect to you as a person, learn a little bit about Dr. Julie. So I'm going to start with the fast forward. Now, my good friends at Reliable Tech Help are the ones that are bringing us the fast forward. So for your tech needs, reach out to them at 502 797 7399. Our first question, always a fun one. What is your favorite food?
So I now have food limitations as I've gotten older, which means that I have very narrow versions of food that I used to like that I can't
Yep.
have anymore or have to have a very strange permutation of it. So
Okay.
a food group that I can feel fairly safe eating is sushi,
Okay.
because most of it is fine for me to eat.
I
So
think you'd have a lot of people joining you on that sushi train. So I like it. Okay, number two, if we got into your playlist, what kind of music would we find?
Um, Probably none from my particular playlist because my children run my phone. So you will find a pop music station because sometimes we listen to that. You will find a bunch of Ariana Grande, Sabrina Carpenter, Chapel Roan. Like again, what my kids listen to, Kendrick Lamar, all sorts of things that I like, but would never
Right.
really have heard it without my kids. If it's my playlist, it's probably an 80s music channel just so I can get the variety and be like, oh my God, yeah, that song.
Absolutely. There's some music in from the 80s that has stood the test of time, at least in my opinion.
Yes,
I
yes.
love it. Okay, number three. What are you enjoying right now in the realm of TV show, a book you're reading, a movie you've seen?
Um, I don't get a ton of time to watch TV, which is really unfortunate because it
Mhm.
it was a hobby I loved. But I'm watching the second season of Bad Sisters, and that is fabulous. Um,
Okay.
I'm reading a book because I'm introducing the author tomorrow at a book festival, and it is a super interesting book. It is about sex, the idea of not so much gender, but biological sex and how it is a spectrum and we need to think of it as a spectrum, even though we look at it as, oh no, there's just two chromosomal sets. So this is
Right.
an author who has really dug into it in terms of the science, in terms of what it looks like across species. And it's really been eye-opening to me.
Okay, that sounds fascinating. And then number four, last but not least, what is a bucket list travel destination you'd love to go to, but you haven't yet?
I feel like there's so many. I'd really love to dive the Great Barrier Reef before it's no longer there. So
Okay,
Australia.
I like that. I like that. The Great Barrier Reef. And then maybe afterwards have some sushi while listening to some 80s music.
There you go. That sounds ideal.
Okay, great. Again for being on the podcast. We have a lot of people that come from a lot of different walks of life. So I guess for the audience that's never met you, tell us about your background and how you kind of came to intersect with folks who are supporting kids that and families that are on, let's call it a different path.
Yeah, I'm probably not like most of your guests because I'm kind of ancillary, but also in it. But came to this work more ancillary. So
Yeah.
I'm a reproductive psychologist, which no one's ever heard of. It means that I work with people throughout the spectrum of their reproductive years and including perimenopause and menopause, which I include as part of people's reproductive years. And so I deal a whole lot with people that are experiencing pregnancy, people that get various kinds of information in pregnancy, people who might need to really think about that information and how does it fit in with what their parenting expectations might be. So it's just, as I said, that's sort of the ancillary part. Um, and so I help people make decisions, basically. Parenting decisions is how I look at them and how I frame it. Um, Additionally, as of last year, my youngest child was diagnosed with ADHD. So again, I sort of came into it, and even prior to that, my sister-in-law has was born with structural challenges in her brain. And so they never
Hmm.
thought she was going to live past a year. She's now in her 50s. So very clearly she has
Wow.
exceeded expectations. And her husband has a mosaic Down syndrome. So
Okay.
like very much in the community, also sort of ancillary to it. So it's a little bit different than I think other people are. I'm like a
Yeah, I love the
latecomer.
I love the perspective. That's one of the neat things about this podcast is we have so many different people that kind of come to it, and I think they all enrich the dialogue. One of the topics that typically gets put way down the list for all of us in general, but especially for parents traveling the road of a kid with extra challenges, is the idea of parental self-care. Talk to us about how you've seen that play out with families that you've been working with, counseling, and what are some of the pitfalls and what advice do you give people or takeaways have you learned over the years in that concept?
So I love that this is what we're starting with because just like you said, this is sort of down the list if we even get to it, kind of an afterthought, if it works
Yeah.
into our schedule and, all of the things align. Um, so I love the analogy, and it's an overused analogy of being on an airplane and the flight attendant says to you, okay, in case of emergency, oxygen masks will drop down. Put the mask on you first before assisting any children, which is
Yeah.
the complete opposite way that we tend to view parenting, right? It's put it on our children first before we do it to us. So the same kind of a view for self-care, I think, is really what those flight attendants have been telling us for years and years and years, is that for us to be good caretakers of our children, we need to have a full bucket. And
Mm,
life empties our bucket. Every day our bucket gets or fills our bucket, and sometimes our bucket gets overflowed. And so
yeah.
when our bucket overflows, we have no capacity for anything else. And so the idea of self-care is a way of taking some of that water out of our bucket so that we have room to fill it again. So that like that might be an easier way. We talk to our kid all about it too when they're feeling really intense feelings. We're like, oh, it sounds like you have a really full bucket right now, a really full glass.
Yeah.
Sounds like we need to empty your glass. How might we choose to empty your glass right now? Um, so that's
And
an
what is your advice to people who they get the concept, but they just
Mhm.
can't figure out how to do it and how to
Yeah.
work it into their busy lives?
So I think the other piece too is that people have this idea that self-care has to be this big thing, this really concerted effort. It needs to be taking yourself to a restaurant for dinner, or it's a massage, or it's this like a luxury that you wouldn't tend to do for yourself. That is a version of self-care. It is not the
Hmm.
version I tend to talk to with my clients about because those are the special kinds of things. Those are not things you can do all the time for a whole lots of
Mm,
different reasons. So I like to look at self-care really on a micro level, which is, okay, can we find 5 minutes to focus on you? And maybe that just means taking 5 minutes to breathe, taking
mm,
5 minutes to look around and notice where you are. Maybe it's like a quick 5 minute kind of quick walk around the block. Um, 5 minutes. And of course, we can increase from there, and hopefully we do. Um, I know for me, a lot of my self-care was actually figured out in the pandemic, which is sort of ironic. But
mhm.
that's where I really discovered the magic of nature. And for me, nature is hugely calming on my nervous system. So being able to take a walk in the woods or even just sitting on a rock, listening to a creek, it doesn't have to be anything fancy.
Yeah, I love that. I love the idea of just finding those moments. And what would be your message to the parent out there that's just like feels guilty when they invest in themselves?
Yeah. So again, I go back to that analogy that the flight attendant tells us, which is we are no good. And I have so many clients who are like, I know I would love to do it, but then I'm spending time on myself and that's less time I have for my child. I go,
Yeah,
yeah, you're right. And if your glass is overflowing, you're not going to be the parent you want to be with your child. So by
right.
doing self-care, it's a way of emptying our glass. And so by emptying your glass, you're actually being a better parent for your child. Like this is a win-win for everyone. Because no one likes to be that stressed out parent who has too many things to do. And when their children are talking to them or trying to engage with them, they just respond with frustration.
Right. Yeah, you don't show up as your best self when
No,
your bucket is overflowing like that. And you want to be your best self for your kids. So you heard it here. We're giving you permission. Self-care is okay.
100%. Can we say that it's the doctor's orders? How's that?
Okay, doctor's orders. I like
There you
that.
go.
Well, what about the idea? I think one of the things in you think about having a kid with differences, there's a lot of services, therapies, doctors, things, all kid focused. How much have you seen over the years it evolve, or is it still underrepresented where we turn and say, hey, mom, hey, dad, how are you doing? That the mental health piece of this journey for parents, how
Right.
prevalent is it? I mean, that's obviously your space.
So I similar to self-care, it's whatever we can do with our kids. And we all have a finite amount of resources, and our resources will vary from family to family. But we have a finite amount of them. And with that finite amount, we have to decide what resources go where and why. And I think what happens too is people don't necessarily evaluate the resources they've chosen. To be able to
Mm,
evaluate, okay, so we've been doing this for a year, what has been the gain from it? Is this something that makes sense to continue? Are we not seeing the gains? Might we reconsider something? What I
mm,
see parents do all the time, particularly when economies are a little bit finicky or uncertain, is all the resources go to the kids. That makes sense. But it's like, nope, I can't be in therapy for myself. I have to save these finite resources for my family. And I'm even
mm.
seeing that too with people who have used insurance to see providers. And it's like, yeah, even that copay, I feel like because things are so uncertain, I don't know what to do with that. So I'm gonna opt out. It's also really hard to sit there and tell people what to do with their money. So I want to recognize
Right.
that. Um,
Yeah.
but there's also some great free spaces that you can go to. I think support groups are really underrated and underutilized. And there tends to be some great either low cost or no cost support groups that parents can join, particularly if they're comfortable in the virtual space. And some
Hmm.
people are not because they don't get the privacy that they would need for it to really feel like they can be showing up for that as well. So very selfishly, I'm such an advocate of therapy. And again,
Hmm.
to be the best parent you can be, this is a tool. Maybe this is your self-care for the week, right? Is like, okay,
Sure.
my big self-care thing is I'm gonna go to therapy. Um, but I recognize therapy still has stigma. Therapy can still be inaccessible. Um,
Right.
and so we can be creative about it. That's why I come back to like groups are amazing.
Yeah, absolutely. Well, in working with all the different families in these stages of pregnancy and kids, and especially kids who get diagnoses that are different, you're guiding people with a lot of different forks in the road and choices they have. So talk to me about some of your insights from that perspective.
Sure. So a lot of the people I work with tend to be either trying to get pregnant, and it is not the easiest journey, or they are pregnant, and sometimes that's not the easiest journey, or
Hmm.
the fork comes in pregnancy because they get some information about the pregnancy in which can be really difficult. And
Yeah.
so I look at pregnancy from there on, even imagining having a child, like that starts our parenting journey. So even before
Hmm.
a physical child has manifested itself, we can still be seeing ourselves and looking at ourselves and hoping for and dreaming about what that parenting identity will look like for us.
Absolutely.
So when people are going through IVF, they have the ability to get a lot of information. And sometimes it's really useful. Sometimes people go through IVF very purposefully because they know that they have some kind of genetic disorder that they could pass down. And they want to
Hmm.
make sure that they don't do that. And so when I'm thinking about genetic disorders, I'm thinking about things like Tay-Sachs. I'm thinking about things that can be life limiting. Huntington's disease. So things that are, I think parents feel very guilty should they pass that on, knowing that they could pass that on, and also knowing that possibly there was something that could have averted it. So there is a kind
Yeah.
of gene testing in the embryonic stage that can see if a particular embryo has a particular gene marking for a particular kind of disease. Um, so that's kind of the first place, and then sort of deciding, okay, what do we do with that? Um,
Yeah.
I can get into a boring conversation about mosaic embryos, which we don't need to go into, but there's also a lot of decision making around that. Like, do we use embryos that might be seen as aneuploid, which would mean potentially chromosomally abnormal, meaning having too many chromosomes or too few chromosomes, or
Sure.
or do we take our chances on them? And mosaic embryos are when, like, well, it might look like this and it might not, and we're not really sure where the cell might divide and create itself, so we're not really sure what this actually means. Like, this might be just about placental information, or this might be entirely about that future baby. So that becomes hard too. Anyway, moving on from that, when I see people in pregnancy, um, particularly if they get what I like to call a gray diagnosis, where the prognosis cannot be ascertained in pregnancy, where it's really
Mm.
kind of a coin flip. The one that really comes to mind that people can find out earlier in pregnancy would be Down syndrome, and
Hmm.
really being able to figure out, here's a cross point, and here we are coming to this, and what do we do? And,
Yeah.
and this is a space that is so difficult for people because there are lots of examples of incredible people that have incredible lives with Down syndrome.
Hmm.
Those are the examples we see, in fact. Like, those are the people that we really see. Um, and so it's, oh, well, if this is the case, then okay, I think I like to frame it as parenting boundaries, but yes, I think my parenting boundaries can accommodate that. Um, However, we can't in pregnancy know a total prognosis. So just like everything, there exists a spectrum, and there are people with Down syndrome that are super high functioning, and there are people with Down syndrome that are really low functioning, and you don't
Mm.
necessarily know what you're going to get. And so there can be a lot of guilt if someone decides not to continue the pregnancy but
Mm.
there's so many other people, and, am I a horrible person because this is the choice that I made? So I think
Or even potentially a horrible person for considering the choice, right? I mean, I'm sure
I,
there's that too.
oh my gosh, absolutely. Especially with the child you have, and you're like, oh my God, if I'm honest, I was thinking about ending this pregnancy, but if that was the case, then this wouldn't be the child I would have had. And we have so many amazing, interactions with this kid, and such an interesting kid and bright kid and fun kid, except for those moments when they're not. And those are those
Right.
moments too, where kind of it creeps back into you of like, oh, I had a choice. And that's something that I don't think parents ever want to talk about. They
Right.
never want to talk about the kind of the Twilight Zone version of family, right? The Twilight Zone version is that it all went according to plan, right?
Yeah.
That's when you are a parent with a child with disability. I don't think that's the path anyone purposefully sets on. I don't
Mm.
I don't think we're sitting there in IVF clinics being like, ooh, 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 let's transfer the embryo that has Tay-Sachs, like being really
Sure.
purposeful about that. So for so many of us, disability just kind of comes on us, and then we have to rise to the occasion. We have to be able to manage our own biases because we all have them, and
Hmm.
really learn to reframe what does that look like and what does that say about me? What does that mean about me? But really, it's not about me as a parent. It's how can I do the best for this particular child?
Yeah, and it's probably so important to acknowledge those range of emotions and that guilt and those feelings parents have, and also not judge them for having them. I think that's probably the key. That's the takeaway I'm hearing.
Yeah, yeah. And I think what becomes really hard when I'm counseling people, and I'll go back to the Down syndrome diagnosis just because I think that's one people can really wrap their heads around,
Sure.
um, where there are so many communities that are set up of parents who have kids with Down syndrome. And
Hmm.
I encourage my clients, I'm like, go into some of those communities, get a sense of what the range is like, get a sense of what life looks like, get a sense of can you picture that for yourself? And then, also go to the communities where people decided to end the pregnancy and sort of sit in that for a little bit and see whether or not that is something that um, you can manage too. Because both of these things are taking on a different burden, and both of them are parenting burdens. And maybe burden is not the quite the right word, but it is taking on something irregardless of what choice we made. So it's kind of this situation where no choice feels absolutely good or absolutely right. And it's about the right choice per family, not what is in general the right choice. And I think we get really stuck with this idea of there is a right choice and a wrong choice. And so again, the way I look at it is every family has a right choice for them, and that is going to vary, and that's okay that it varies.
I love that. Well, thank you for that perspective. That's, again, probably like you said, not an easy or often talked about part of the journey. So I appreciate that.
Yeah.
You mentioned family, and that's another one of the big topics of like, there's a whole family, there's siblings, there's
Right.
that significant other, often marriage relationship or significant other relationship. And when you have a kid who has extra challenges and there's extra time and therapies and doctors and surgeries and stresses and ups and downs, there can be that ripple effect. So, talk to me about what you've seen over the years about impact on the family and any guidance for families on how to manage that or recognize and move through that.
Since I tend to work with parents, typically my advice tends to be more around what can you do for yourself so that you have more
Yeah.
bandwidth to manage this. So I'm going to actually not answer that from my professional capacity. I'm going to answer that from my personal capacity. Um,
Yeah.
that my partner has a sister with a disability and
Hmm.
has a child with a disability. And so
Yeah.
has a lot of experience with this. And we've talked a lot about what it was like for him growing up. He was the middle child. And he understood it was his job to help make things as smooth as he could for everyone in his
Hmm.
family. It was sort of his job to help out. He really understood from a young age that his older sister had different limitations than he had. And
Hmm.
so he might need to fill some of those gaps in order to, again, sort of help the family be able to get along and to go along.
Yeah.
So
I
he
can
would
see
tell me
that.
like really, really simple things of like, yeah, if we're in a crowd when we were younger, my dad and I would have my sister in the middle. So we were kind of being these bodies to protect her so that she wouldn't
Mm,
necessarily get lost in the crowd and she would know where she is. Um,
okay.
so a really different kind of way of growing up. That was not something I had to do in my family. It was like, nope, you go out wherever you want, it's fine. Um, I think too, he has a really unique perspective in dealing with our youngest child. And he is able to connect with our youngest in a different way than I can because my husband understands their version of neurospiciness because it kind of overlaps with some of his neurospiciness. And
Uh-huh.
so I feel like a lot of the times I'm really a learner in the show, and I'm like, okay, we are going to do the best that we can. But also
Yeah.
recognizing too that it's okay to tag in. And then I see not just the impact it had for my husband and his brother, but also I see my other kids and what this impact is. And sometimes they feel like, oh, there's no time for us. Or what I really hear a lot is, you treat that one differently than you treat us, and that's not fair. And,
Mm,
what we come back to is, yeah, you're right, but, you know, fairness is not about being equal. Each of you needs something different in terms of
yeah,
what is fair, but fair does not have to be equal. So we want you to have equity and not equality. And it's such a weird thing to think about, because you think about,
yeah.
no, no, we're taught about equality. Um, and there's a really great series of pictures. I'll try to describe them. So picture like an apple tree. And then,
Hmm.
picture like a hill by it. And the kid that's standing on the top of the hill can eat, he's a taller kid and can grab apples. Not a problem. Then there's a kid who, even if he stands at the top of the hill, is not tall enough to grab the apples. So, okay, great. Now we build a step stool for that kid that's not as tall to grab the apples. Now that kid can grab the apples. That is equal, right? Okay. But what it doesn't help us is if we're down the hill, that step stool is too short for anyone to stand on it and still be able to access apples. So to be equitable, it means we have several different kinds of um, benches that are different heights depending upon where you are in the hill, so that anyone standing on it can be able to pick apples.
I love that. Yeah, that's really powerful to picture. And I'm sure that concept of equity versus equality for parents is probably a really profound one.
Yeah, absolutely. And it's hard for other kids to get. Like, this is something we have been saying for years and years and years. And I imagine not until my kids become much older will they understand what it was we were really trying to convey.
Yeah, I love that. When we talk about kids and especially having multiple kids, the topic of expectations or like setting the bar, with parenting, I always talk about the spectrum from the helicopter parent to the let them figure it out on their own and they'll grow from that parent. That exists in, if is there such a thing as typical parenting, but let's just say typical parenting, but then you take special needs parenting and there's this a tendency to like, oh, this kid's going through so many challenges, maybe swoop in, not only the parents, the grandparents, the aunts, uncles, do a little bit more for the kid. Hard to let them do things on their own, especially if they struggle. How have you seen that play out with the families you've worked with, and maybe a few stories about that, or and also what's your takeaway and advice for parents on how they set that right level of bar?
So I think we have ideas for how we're going to parent before we actually have that job to do. And we get
Yeah,
some of those ideas from the parents we watched, which most
yeah,
likely are our own. And because all parents are people and all people are human beings and all human beings are fallible, none of us grew up with perfect parents. Sorry.
right.
So sorry. You might have grown up with good enough parents, and then that can feel kind of perfect because they did all that you needed them to do, but certainly they
Yeah,
weren't perfect. So it can be really hard to grow up, and not, maybe you had a terrible parenting model. And so maybe the way you set up for yourself to be a parent is, that's what I'm not going to do. Or if you have
mm,
a good enough parenting model, oh, I want to make sure I replicate all of this because this all felt really good. So now factor in the children you have, which are not the children necessarily you've fantasized about, because all
right.
people are different. Even having typical or neurotypical children, they're still not going to be the kids you fantasized about. Um, and so being a parent starts that sense of, well, what are our expectations? And I think sometimes it's about looking to see what else is there. I think a lot of
Yeah,
us get our information from books. And what I like to remind everyone is that there is no book that has been written on your kid. So
absolutely.
use these books as guides, but don't use them as Bibles, because they are not the end all be all for every single kid. Um, the joke I have with my new moms is I'm like, so did your OB give you the handbook for your kid? It should have been in the placenta. And they're like, no, I didn't get a handbook. I'm like, yes, none of us get it. Those OBs are so, oh, how could they not give it to us? Um,
Right, absolutely.
there is no child manual. There's no parent manual. And I think that too becomes really hard. So, um, my husband tells another story where he was with my dad. They both have very different parenting styles. And our oldest was on a jungle gym and he was like climbing up it, doing his thing. Like he was pretty high, might have fallen. He was young, like, and my husband hung back. And my dad's like, no, we got to be there right under him. And my husband's like, why? And my dad's like, because he could fall. And my husband's like, you're right. He could fall, but then he has to learn what to do when he falls because there are going to be
Wow.
lots of time in life where he's going to fall and he needs to have those skills in how to manage it. I think it is kind of the opposite thinking when you have a child that has some kind of special needs where it's like, wow, life is already so hard for them. What can we do to make it a little smoother? Um,
Yeah, that's a good point.
yeah. And so it's a lovely sentiment. And it doesn't mean that all things have to continue to be as hard as they can be, but you might want to consider what are those things that I can let be hard where I'm not coming in and softening the edges? What are those things that my child might need to try and you know what? Fail at or fall so that they can learn for next time. And next time, because we all learn from failure, which no one likes to acknowledge or admit, but like failure is our best teacher. Um,
Yeah,
so we learn from that. We learn, oh, don't do that again. And so we do something else. And maybe that second time we fail too. So it's like, okay, don't do it that way. Don't do it that way. Let's try something else. Um, but it allows for that creativity to come to the brain too. It allows for perseverance to come as a skill that not everyone has. So there are a lot of benefits neurologically as well as a characteristic for your child that letting them fail or letting them fall, being strategic about it if you can, but
right.
allowing for that experience, that can't be the toxic experience of, oh, we can't allow for that because when it happens, they're going to feel let down. Why didn't you help me? Why didn't you fix it? Why didn't you prevent it?
Right. Well, and I've heard some people describe it as if the goal is for your kid to be as productive as they can when they're an adult, you have to ask yourself, what will they do when I'm not here? And
Absolutely.
what can I do every day to help them, like you probably naturally would do for other kids, but you maybe don't do it as much for kids with extra challenges. But like, if we do stuff for them, how are they ever going to learn to do it?
Right. Absolutely. Yeah, and it is going to be different with each kid depending upon who they are, what their needs are, what their abilities are. And so being able to adjust expectations as they can be adjusted. So it would be really unfair for me to expect my youngest to be able to make their lunch when they were 3 years old. I have to
Right.
adjust that expectation. Maybe I would like them to make their lunch when they're 3 years old,
Sure.
but I have to adjust that expectation because they don't have that skill set yet, that series of skill sets, quite honestly.
Yeah.
But now that they're almost 12, yeah, it might be a fair expectation that they go make at least part of their lunch. Um,
Yeah.
so what might that look like? And I think, again, particularly for a child like mine, that means there's a lot of pre-talk about it. There's going to be a lot of ways of making it theirs so they don't feel like something got put on them. They have to feel
Right.
like they have some ownership of how we're doing it.
Absolutely. Okay. I want to ask you one other big overarching question, but first we're going to take a short break. When you have a kid who is different, all your ducks need to be in a row, especially your money. Cam Howell with Primerica knows the joys and challenges as he and his wife raise their medically fragile son, Brooks. Cam brings over 13 years of experience to help his clients be protected, have a plan for the future, reduce debt, and connect to resources. Get your financial house in order so that you can enjoy every moment with your child. Reach out today at 502 803 5075. So I always like to sort of, and I kind of feel like I knew this was going to happen. We could probably talk for a couple hours, but I don't think anybody wants to listen to a 2 hour podcast. So I'm always kind of wrapping things up to keep us on time. And it's a very oversimplified question, but let's imagine a local children's hospital there, you're in Maryland, brought you in and they had like 50 parents in the room and they've got kids with a whole range of different, let's say, diagnoses. They're maybe all 6 or under, and you're up at the podium and they're like, tell us what to do, tell us the keys to success. What are your big overarching 3 4 key concepts for parents to really get that'll help them on this journey?
I think the biggest one is actually what is in us. And so allowing ourselves, giving ourselves grace, compassion, and allowing for mistakes. That
Mm.
you're human, you will not be perfect, you will get this wrong, and that's okay. And you're
Can you
not
say that again? Can you say that again?
absolutely that you are human, you are not perfect, you will get this wrong, and that is okay.
That's a great start. Okay, what else?
So I think that part too is just sort of allowing for, okay, I think the other point I would make too is um, who are your caregivers? Because it's really hard to be a caregiver. Anyone who's
Mhm.
ever had a baby or anyone who's ever had ailing family or parents know how hard it is to be a caregiver. There is such a thing called caregiver burnout. There is a
Mm.
reason there is a thing called that. And so, who are the people who can step in and give you a break? So it's caring
Mm.
for the caregivers, kind of like the idea of self-care, but maybe amped up a little bit. And it's
Yeah,
not only the people that can care for your child or children for a couple of hours, but might there be a person or people who can care for your child for maybe an overnight, maybe a weekend? And I recognize those can be really hard asks. And I recognize there's always the feeling of nobody is going to be as good for my child than me. I mean, I have
right.
a client that's very stuck in that kind of place. Um,
Yeah,
and so it can be really hard. But I think when you're stuck in that place, it means you're not curious about how might we see if we can find someone. Because
right.
if I don't give someone the opportunity, they can't learn from me, nor can they help me in the way I really need to have help.
Yeah,
So again, it kind of goes back to that idea of like, it's okay to be selfish. And in fact, you need to train yourself to be selfish. We think of being selfish as this bad, terrible, awful thing that we should just purge from our very being. But we don't think about selfishness as the ability and the right to take care of ourselves. Like
yeah,
we can be selfish because we care about ourselves. I'm not talking about every single moment of your life, but you can
sure.
take some time and purposefully be selfish.
Yeah, I love those. And I love both of those because they're, again, empowering the parents. Because if they're empowered, they're probably going to be way more equipped to do the right thing for their kids.
Yeah, absolutely. Um,
Fantastic.
yeah, and that way you're providing really good role models for your kids so that when they become parents, they have a really nice template to build from.
I love that. Well, Dr. Julie, this has been fabulous. Thank you so much for being here. I know you guys enjoyed this. If you did, please like, comment on the post on this. Follow the podcast. We'd love you to rate and review the podcast. And we're still a little bit of a best kept secret. So we would love to connect to organizations that you know doing good work, to people you know traveling this path that would love to share their story. Please reach out to me on the Facebook page for future guests. Again, I know you have a lot of choices when it comes to listening. So, first of all, Julie, thank you for being here today.
Thanks for having me, Jim.
And thanks everybody for tuning in. All right, everybody, we'll see you next time.